Hi, I'm Dr. Professor Alex Rhema Zachariah, MD, a retired medical oncologist, originally from India, but now settled in Urbana. I was recently the Chief Medical Officer of Provena United Samaritan Medical Center in Danville, Illinois. Now my wife, who is also a physician, we are settled here in Urbana, and this is a series of programs that we are bringing to you for your information and education. And today I have with me Chris, who is the American Cancer Society volunteer. And with Chris we have Anne, who is a healthy cancer survivor. And Chris, tell us.
Thank you. I am a volunteer with the American Cancer Society, and in my role with them is I participate in the Road to Recovery, which means that I pick up and take patients to their treatment areas and then back home. And we can spend as much time volunteering for this role as you want. It can be 2 hours a week. It could be more hours if you have them. It is something that is very dear to my heart, as my husband had cancer, and I took him to a lot of treatments, and this is sort of an extension of that, in that I really feel that I am helping someone who may not be able to do that themselves. I'd like to also introduce Anne Reid. Anne is a survivor. We met when we were doing Relay for Life. The Relay for Life for 2013 will be held June 8th and 9th at the track behind Centennial High School. It's a fun event, and we encourage people to come out and take a look at what we do to raise funds for the American Cancer Society. We would hope that very soon we find a cure. Anne, go ahead and tell us your story.
Thanks. I was diagnosed with rectal cancer in October of 2008. It was completely out of the blue. We had no history of colorectal cancer at all in our family. Mm-hmm. The symptoms I had was blood in my stool, which, I kind of ignored it for a couple weeks and then ended up on the tissue. And so I said, this needs to be checked out. So I went in and saw my doctor, and I was thinking it was hemorrhoids, and I went to my doctor's appointment by myself, and she couldn't find anything. And so the following week I had an appointment with a colon rectal doctor, and he gave me an exam, which is called a flex sig. And so again, I went by myself, not thinking it would have been cancer. And on the examination, he said, "Oh, this doesn't look good," and I'm 90% sure it was cancer.
Oh, golly.
Yeah, I was very upset. Of course, I called my husband, and I had a friend that came and picked me up. So the following Monday, I was scheduled for a colonoscopy, and they biopsied it. And that Wednesday, my husband and I went and got the results that, yes, it was cancer. And then that following week, I had surgery.
Wow. Now, in your surgery, did they remove any of your intestine? Had it infiltrated your intestines at all, or was just...
No, it was a stage 3, which they took the top half of my rectum out. They took 12 lymph nodes out, and so one of the lymph nodes had cancer cells, and so that's why it was a stage 3. It didn't...
had not gone beyond that?
No.
Oh, and, wonderful, wonderful.
And bonus, they took out my appendix, but...
Yeah, you won't have to worry about that for a while.
Now, Anne, as a medical oncologist, what was the timeline when you first noticed blood in the stool and before you sought medical attention?
I think it was like 2 weeks.
2 weeks.
Yeah.
Hmm.
That's all my, you
like-
let things go 2 weeks, then you go to the doctor.
Yeah.
Very smart, though.
Yeah,
Very.
but like most of us, we just think it'll go away.
Ignore
and
it.
Right.
Exactly.
And the blood on the tissue just kind of freaked me out. So,
Yes.
yeah.
So 2 weeks. That's a good time. But there are persons who ignore it
Right.
for weeks and weeks. That is not good.
Yes, I know someone that their son had ignored it for a long time, and was stage 4 and it's terminal. So,
So you would definitely anyone and everyone
Right.
who hear any of this kind of blood anywhere,
right.
either in the mouth or in the stool or anywhere, is a warning sign.
You know, and the guidelines is to get a colonoscopy when you're, reach age 50. I
Yes.
encourage everyone to do that.
Yes.
Yes, the prep is worse than the
The
procedure.
actual test.
It
Yes.
is.
Yes. Yes.
So,
All the fluid that you have to drink for
Right.
the prep.
Yes.
And anyway, so tell us about the surgery.
they did a lower abdominal anterior resection. So they took out, again, the top half of my rectum and then reattached it.
Yes.
And I was fortunate, it all went well. I didn't need a, colostomy bag, and I had a 4-day hospital stay
Where?
at Carl here in town.
Very good. So they did a very good job, and you had a uneventful recovery.
Yes, yes. So.
And after that?
After that, I had about a 3-week recovery period, and then I started radiation.
Yes.
And I had radiation every day, Monday through Friday, and then I had a chemo pump with I believe the 5FU
Yes.
that they put on Monday and took off on Friday.
Yes.
And that was kind of because our health insurance, we buy it ourselves. My husband and I are self-employed. So the day I was supposed to go to Carl to get my pre-imaging, set up for the radiation, the accounts payable, anyway, the people called and said, you cannot go to Carl. Because the clinic is not a hospital-based clinic. So that was very taxing, and
Yes.
so I ended up going to Pravina, to their cancer center with my radiation, and then I had to go to the Carl Hospital to get my chemotherapy done. I couldn't go to the nice cancer center that the clinic has. So
And how long?
I had 5 weeks
Yes.
of the radiation, and after the first 2 weeks, I became toxic from the chemotherapy. I entered I had so much diarrhea, nausea, vomiting,
Yes.
cramping, and so I went into the hospital on a Sunday, and it was basically nonstop. And I was in the hospital for 4 days. I got to go home. It was Christmas Day.
Oh, wow.
Yes, it was Christmas Day. And so
Did you receive fluids?
I
as part
received
of that?
fluids. I had to take the shots to
Yes.
build myself back up.
Yes.
And actually, I took, you would probably know what it is, the brown liquid, to keep the nausea. So yes.
Yes.
Yes. So I lost, the whole time, I lost 30 pounds.
Oh, my goodness.
Yes, my hair thinned out a lot. It didn't totally fall out,
Yes.
but that was very frustrating to clean up the bathroom floor several times a day, taking a shower, and clumps of hair come out while you're showering. So that was
It's
very
a very,
hard.
very difficult.
Yes.
I can just imagine how you felt during this time.
Well,
So you had nausea, you had diarrhea,
cramping.
and cramping. So it was not. It was a difficult time.
Yes, had loss of bowel control.
Control.
Yes.
And then you had very good family support.
Yes, I did. My mother lived in town during that time, so my youngest one was in high school, so she went and would pick her up from school, and I had to call her and said, you know, I can't pick her up from school, or my husband would take her to school. I had lots of support from my church, so
Yes.
that was really, that got me through it.
I think it's extremely important that you have outside support, not just from your family.
Yeah.
They can, and especially at church. I'm a very faith-oriented person, and I know you are, and it is extremely helpful to know that there are other people who care about you.
And you were certainly touched by this outpouring of support and compassion.
Yes, the ladies in the church knit me a prayer shawl, so that was very comforting.
Yes.
I really felt that when I was in the hospital. I had one friend that she said that when she was praying, she got an answer from God that said, Ann is my servant and I'm with her. So her sister, well, she cross-stitched a cross,
Yes.
and her sister framed it and put that
Yes.
on there.
Oh, how touching.
So they also put together a basket for me,
Yes.
you know, with things a cancer patient would enjoy. And I got cards from all over.
Yes.
Cards from friends of my sister-in-laws that I didn't know.
Yes.
People praying from all over. We had friends in Hong Kong that were praying.
Oh, wow.
So, yeah.
So that is a very important aspect of cancer management.
Yes.
In the sense that we always want to make sure that there is support and there is care that is expressed and that you receive it because it helps healing.
It is, and it's hard, you know, for a person like me who takes care of people to ask for that help. It is hard. You know, you're losing the control basically of your life.
Yes.
You know, you're going to doctor's appointments, you're going to treatments, and you're focusing on that. So,
So at what time, Chris, your path crossed?
Well, our path crossed about 2 years ago.
Yes.
A little more than 2 years ago. Ann became involved in the Relay for Life as a committee member, of which I am also a committee member. Relay is a huge event, as I had mentioned earlier. We really hope that with our fundraising, and it's also a fun event, that we will be able to get a cure for cancer soon. But it's been a little over 2 years that Ann and I have
Yes.
known one another.
Yes. And both of your roles as committee members, tell us something about what you do, or what are
Okay.
your responsibilities.
Okay. Ann, why don't you go first?
Yes.
well, this year I started out with helping get team captains and team members,
Yes.
and now it's
Can you tell the structure of this, of Relay of Life, for our information?
well, you have a committee chairperson who organizes everything, and we
Yes.
work with the American Cancer Society staff. So you have a
Yes.
staff partner, and then you have different committee members that head up different tasks. For instance, survivorship.
Yes.
The luminaria, the bags that we
Yes.
sell, to make sure they're in place at the event.
Yes.
I'm helping with logistics, make sure we have the necessary, the stage, the porta potties and things like that. They're in place and
Yes.
in the right areas, and so then you have people that help on those different committees, and then everybody helps at the day or two of event to set everything up and to clean up and make sure it runs smoothly.
And this event is one day in a year? No.
Well, it actually encompasses two,
yes.
June 8th and June 9th. We begin at 6 p.m. on Saturday night and end at 6 a.m. on Sunday morning. And there is usually someone walking the track
Yes.
at all times during the night.
Yes.
We have an opening ceremony where we have a bagpiper who walks the track ahead of the first people who are walking along with him are survivors. The second lap is caregivers, and followed by anybody who wants to walk on the track.
Yes.
I'm involved in the Luminaria Committee. I've been doing this. This is my third year with Luminaria, but prior to that, my daughter was the chair and team captain in several places, and I just helped out wherever they needed help. And I can do that as well at this time. But the Luminaria is a paper bag that you can purchase for $10. And on the evening of relay, all the luminaria are placed on the inside and also on the outside of the track. And when the lights are turned down, those are all lit so that you have this warm glow emanating from both sides of the track. It is such an awesome feeling. It's
very moving.
Very moving. Very, very moving.
So, Chris and both Anne, this year I would request the UPTV to sort of depute a couple of interns. So I would be with the interns going to cover the Relay of Life, and you both need
Excellent.
to. You both need to.
We'll be there.
No, we would do it.
Oh, okay.
In the sense, I'm there with the intern the UPTV would provide, and then you would just tell everything.
Okay.
So,
Well, in the future, I do plan to have our chair of the event. Her name's Jill Rannenberger. I haven't contacted her yet.
Yes.
But she is, I believe, a couple weeks away. And if she can meet it at that time.
yes.
Next week, I hope to have a mother-daughter team, I guess.
Yes.
Who have both survived breast cancer.
Yes.
And we're working on future interviews beyond that.
Yes, yes, we would be bringing them one by one. And coming sort of back to you, how long it took for you to regain your normal health?
Well, I really haven't fully regained it. My feet are still numb from the neuropathy.
Yes,
The chemo kills your
yes,
nerve
right.
endings.
It takes
So,
time, yes.
but thank the Lord, the bowel control this last couple months have been a lot better.
Yes.
Good.
So yeah, so it's been 4 years. So I didn't feel like it was going to take that long. That was one of the hard coping with the side effects because you
Yes.
don't know when it's going to end. You
Right.
know, if you had a time schedule, I was told, you regain your muscle
Yes.
control
Yes.
within a year or so, and it just kept going. It kind of felt better having a date, but
Yes.
now I've just kind of accepted my
Yes.
feet. They are getting better, but it's slowly.
Yes.
So
What is your weight? Have you got back to your weight? We don't want to be
unfortunately,
obese.
yes, not my total weight, and I am working on my weight. I'm exercising more. I'm walking on the treadmill
Yes.
and
Oh,
doing a
good.
little jogging. So my goal is to do the 5K at the Illinois Marathon, to walk it
Oh, good for you.
in April.
Wow.
Yeah.
Good for you.
Keep that going.
Yes.
And that is excellent.
Yes.
And how about the appetite and the food? You just back to normal?
Yes, yeah, back to normal on that too. Yes.
Mhm. And see, rectum is a very important aspect
Yes.
before the exit. It does a lot of things. So to lose a significant part of that, and that is why it is taking
Yeah,
time.
I more frequently, I go to the bathroom more frequently because
Yes.
it's only half there. And I
Yes.
think with the chemo and the radiation, the doctor explained it's like a balloon that,
Yes, yes, that's right.
expands it. Probably that lost that
Yes.
effectiveness. I can't overeat on some
Yes.
foods because of
It'll right away. you
yes,
have
and
to go.
yeah.
Do you know of some foods that maybe would react?
Well, tomato products, sometimes
Okay.
have an effect.
Because of the acidity, maybe.
Yeah, chocolate, I think that's, yeah, you can't eat a lot of chocolate, and then even foods that have a lot of high fiber, nuts or something, I'll get, a stomach ache and so.
So you have learned that you had a dietitian to help you to the food?
No, I just kind of learned, and my colorectal doctor just, he always encourages a high fiber diet. I just got a sheet of, high fiber diet. I take Benefiber twice a day.
Yes.
So, and I can tell when I'm not eating, enough fiber because, your bowel habits are different.
Absolutely.
And stress also plays a part, if I have a stressful situation, I have more frequently.
I understand that.
Let me ask you, at any point in this journey, has your faith been shaken, but you just hang there by the skin of the teeth?
Yes, my husband was the rock, so there was a time or two like I can't take this anymore. But
He is such a nice man, such a nice man. So, and I can see him being your rock. He just strikes me as that kind of a person.
And I had more friends that wanted to come to treatment with me than I had treatment, so that.
Oh, that's great. So you really never had to participate or coordinate with the Road to Recovery.
No.
You had enough people.
Yeah, and I
that's
was well
wonderful.
enough that sometimes I drove myself to the radiation, but my husband took me almost every day to radiation. And you look back and see, it was a God thing because it was in the winter, so he works outside. So it was the timing of that situation.
That he was able
to
be there
that.
for you.
What are some of the things you would like to tell the viewer from your experience? And yes, you can go over it again.
Well, not to lose hope, and make sure you do have a caregiver, support. Don't be afraid to ask for help and take that help. We had meals brought in.
Yes.
Someone came and cleaned my house one time. Accept that help and know that you're not going to be totally strong, and let someone else be that strength for you.
From the medical point of view, you would recommend everyone to have the stool test and the colonoscopy.
Right, the colonoscopy, yes. And don't be afraid of that, and don't be afraid to talk to your doctor about things that aren't always so pleasant to talk about.
It's an important test. I come from a family of colon cancer folks, so I have mine done not necessarily every 5 years. I do every 3 years because of that history. But early detection is the key. Definitely the key.
Yes, Chris, would you give some thought, some reflection on this?
Well, again, I think that as someone who is diagnosed with cancer, that they could seek the support of the American Cancer Society. There's many things that they can help with. They're very good about getting you whatever help you need. They even can do some pharmacy prescriptions. I don't know the extent of it, but if there is any question, to please call Pam Barak, B-A-R-A-K, and she's at 356-9079. Or you can call the American Cancer Society. They have a 24-hour, 7-day-a-week hotline, always manned by a real person, and they're at 1-800-ACS-2345.
Yes. Yeah, that brings us a very important point. We don't want anyone to get cancer. But if anyone, you or your friends, have this, don't hesitate to get in touch with American
I totally agree with that.
Cancer Society. There is a wealth of information and help available, and an army of staff and volunteers that will line up to help you out. Thank you for being with us for this half an hour, and we'll be back again with more of experience of American Cancer Society volunteers and cancer survivors. Thank you.